Hello, my name is Ravi Vij. I am from Washington University in St. Louis, and today I will be talking to you about combination therapies with bispecifics. We have now an increasing number of bispecifics that have been approved for utilization commercially. We have for BCMA bispecifics approval for teclistamab, elrantamab, and lately lenvasiltamab. We also have GPRC5D bispecific daratumumab that has been FDA approved. What we now need to look at is how to move these drugs into earlier lines of treatment from the fourth plus line of therapy that they are currently approved for. In that regard, combinations of these drugs are being explored both to increase the efficacy and to make them more competitive with the currently approved multi-drug regimens that are presently used in the first and early relapsed refractory lines of therapy. Uh, as regards to teclistamab, there are a number of trials currently ongoing. The Majestic 2 study is looking at a combination of teclistamab, daratumumab, and pomalidomide in patients who have had 1 to 3 prior lines of therapy and has reported preliminary data with high response rates of close to 95% and complete remission rates seen in about two-thirds of patients. The TRIM2 study, a trial with the same combination, teclistamab, daratumumab, and pomalidomide in more than 3 prior line of therapy, has response rates of up to 70% and complete remission rates of 50% that have been reported. We also know that teclistamab is being studied as maintenance therapy in combination with lenalidomide post-autologous stem cell transplant. And what we have seen with early data is clearly deepening of responses in combination therapy, with nearly 100% of patients having stringent complete remissions when given in combination. We have seen trials with other bispecifics that include elrantamab with pomalidomide and dexamethasone, and elrantamab with daratumumab combinations as well. In the frontline setting too, these drugs have moved into combination therapy with teclistamab. We have seen data in combination with daratumumab and lenalidomide. We've also seen data of teclistamab in combination with very high response rates of close to 100%. In the studies that we have seen in newly diagnosed multiple myeloma, the Majestic 7 study, too, daratumumab and teclistamab have been combined with daratumumab and lenalidomide, with once again very high response rates of over 90%. The Magnetism 6 study is looking at elrantamab with daratumumab and lenalidomide, and too has reported response rates of 100%. The Monumental 2 study combining daratumumab with daratumumab and lenalidomide has produced response rates once again of close to 100%. So these are just but a sampling of the studies that are currently ongoing and starting to be reported, where we are seeing combination therapies produce great responses. We have to be cognizant of the fact that combination therapies do have a somewhat higher risk for complications, especially infections. So we need to see more mature data before adopting these in routine clinical practice. In addition to the drugs that are currently commercialized, we have other bispecifics that are currently in clinical trials, including cevostamab, which is a drug which is an bispecific directed at a different antigen, which is FcRH5. we have seen data presented with cevostamab in combination with pomalidomide and dexamethasone in a phase 1 study called the Gamma study. And in this study too, we have seen impressive rates of response and complete remissions with response rates of up to 100% being reported with the combination. The data on duration of response and PFS in all these studies is still something that we need more follow-up to be able to comment upon. So, in short, bispecifics are moving into earlier lines of treatment. They're also moving into combination therapy. The early results show very impressive response rates and complete remission rates. They do tend to show a somewhat higher rate for adverse events, especially infections. We do not have mature data on the durability of these responses, but usually durability does track with the depth, and we anticipate that these will be very impressive responses that we will be seeing in the years to come. So I think this is a space that we need to be certainly looking forward to seeing more data, and is certainly the way the future is going to unfold. Thank you very much.